Secretary, thank you so much for taking time to be here. We appreciate it. And thank you, Chairman Cassidy, for holding this hearing this afternoon. I think it's great that you're... Sure. Better?
Yeah.
I think it's great that you're here and taking on the tough questions and showing the American people how you're thinking outside the box and bucking up against the status quo to try and change the really tragic and sad trajectory we're on in terms of health in this country. Takes a lot of guts to do that, and we appreciate it. And I think talking about where you're wanting to put resources is always a good thing. So thank you very much. I think the most important thing that you are doing is putting in the work, rolling up your sleeves, and trying to reverse course on some of the horrible statistics that, quite frankly, American is paying attention to more now than they ever have. And I think that has a lot to do with you at the helm. 30% of our population is obese. We rank highest overall in cancer burden, and we're seeing cancer rates skyrocketing, especially among our youth. We have over 500,000 cases of people with Alzheimer's. That's expected to go up to 1 million in the next few years. In my state, and certainly across the country, we suffer severely. People suffer severely from the oppression of chronic disease, and no one really wanted to look at the root cause of that critically within government until you started talking about it. You took the helm and started fostering, allowing, promoting scientific debate, true debate. And that's important in this country. I think during the COVID years, that became very apparent. You said it best in your testimony. Nutrition is the bedrock of health. As a mom that truly wants to make America healthy again, I couldn't agree more, and I'm glad that we're having these hearings. And I wasn't surprised when you chose Miami, Florida as the place where you announced that you were going to engage hospitals and require that they actually serve nutritious food. I will never forget the time I was in the hospital with one of my parents, and they came in, and I was asking what they should eat, what they shouldn't eat of the doctor, and they looked at the plate of food, and they're like, none of this, none of this. And that's exactly why we were in the hospital. I thought that was very strange. But so many Floridians end up in the hospital because they've had a lifelong diet of ultra-processed, polluted food. And so how can we hope to heal people in a medical setting when the food we're serving them is nutrient deficient, infused with microplastics, pumped full of added sugar, artificial dyes? We know that so much of this can contribute to weakening the immune system, can contribute to cancer. So many of our schools aren't even serving food that meets the highest standards, certainly what you would call, I guess, the MAHA standards. Anywhere between 30 and 60% of a child's nutrition comes from school meals, so we have to address that. We all want our children eating healthy, nutritious meals, and certainly for their long-term lifetime health, that's going to be important. Prior to your swearing in, the overwhelming majority of medical students received no nutrition education, none. That's insane. That is insane when you're looking at this chronic disease and the rates that we're facing. Less than 1% of lecture hours in medical schools were dedicated to this fundamental part of health. Just last month, you secured historic agreements with well over 50 of the top medical schools in America to require comprehensive nutrition education, giving our future healthcare providers the tools necessary to attack chronic disease at the most fundamental level. I'm so proud 6 Florida schools were part of this agreement, and they are very excited that HHS has invested $5 million to support the integration of this curriculum. So all in all, before you came along and thought to do these things and pushed for these things, we expected to keep working within the status quo and expecting our chronic disease rates to change. So thank goodness you came along. Florida wants to be ground zero for the fight for nutrition. I know our moms want that. I'm part of that caucus. And you and your team have grabbed the bull by the horns. You've partnered with industry. You're standing strong for our kids and for Americans. How transformative do you think that HHS's new nutrition guidelines combined with new nutrition education requirements for medical students will be for America?
You know, 80% of young doctors today say that they feel inadequate to offer nutritional advice. And you have most of our 80% of our 90% of our healthcare costs are chronic disease that are diet induced. Upwards of 70% of type 2 diabetes can be cured just by changing diet or vastly improved. And a doctor should know that there's other things other than the pharmacopoeia to turn to. You can have dietary changes and lifestyle changes that save your life without getting addicted to a lifetime of pharmaceutical interventions.
I see that I have blown past my time, so thank you very much, Secretary.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.